Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, subluxation of the lens. Okay, in the subluxation of lens is actually the displacement of lens in the patellar fossa is called as subluxation of lens. In Marfan syndrome, sorry. In the Marfan syndrome, the lens are actually displaced upward and temporally. The lens are displaced in Marfan syndrome. They look something like this. The lens are displaced upward and temporally in the Marfan syndrome. So this is the nasal side, this is the temporal, nasal and temporal. So the lens are displaced upward and temporally in Marfan syndrome. Then we have homocystinuria. In the homocystinuria, the lens are displaced downwards and nasally. They are displaced in homocystinuria. In homocystinuria, they are displaced downwards and nasally. So that is, the lens are displaced. If this is the pupil, they are displaced downwards and nasally. This is nasally and downwards. They are displaced in homocystinuria. Then other um, one more thing is Weil-Marchesani syndrome. In Weil-Marchesani syndrome, there is subluxation of the lens is seen, but there is inferior subluxation of lens are seen with microspirophakia and anterior dislocation. Anterior dislocation of lens will look something like this. This is the dislocation of lens anteriorly. There is inferior subluxation is also seen. Even this is inferior subluxation, and microspirophakia is small and spherical lens is seen. Actually, lens is not spherical in shape. It is actually a biconvex shape. But in Weil-Marchesani syndrome, you will see spherical lens is seen in Weil-Marchesani syndrome. Now, what are the other disorders which are associated with subluxation? Okay, subluxation of the lens can also occur in sulfite oxidase deficiency, hyperlysinemia, and in aniridia. In all these conditions, subluxation of the lens is seen.
thank you and thank you for watching.